So today for Women's History Month, I'm still looking at women making history now. And I have the pleasure of introducing our guest today, Liza Mordkovich. Liza is a licensed clinical social worker, and she's also the founder of Bklyn Center for Mindfulness and Psychotherapy. Thank you so much for joining me today, Liza. I really appreciate it.
Well, thank you for having me, Amir. I'm excited to be here.
Terrific, terrific. So, Liza, can you tell us a little bit about how you are making history now, what you're doing in terms of your work that's making history?
Sure, absolutely. Well, I'm the founder of a group private practice, and we are a collective of women. So it's a women's run business. So that's one way that we're hopefully making history to influence other women to start their own businesses and to really thrive at it. We also work with the perinatal population. So that's another way that we treat and cater to women's needs. By specializing in women's health care and women's mental health care. So
that's terrific. And it's that population has so many needs that I've seen go unmet within my own, friends and family groups. So I'm so glad that you're doing that.
Sure, thank you.
What's important to you about the work that you do?
Yeah, I mean, what's important for me is to provide really evidence-based care. One of the things that I've learned in working in this field, that therapy is an art form, absolutely, right? But it's also a science, and that at our fingertips, we have research as to which approaches and which treatment is effective for certain types of diagnoses, right? And issues and problems that people have in life. So one of the things that's very important for me is to provide that, evidence-based care, that treatment that's actually going to work. And to also educate the public as to what that is and what they can do to kind of advocate for or ask questions of other clinicians too when they're looking for support for themselves.
That's absolutely terrific. And I know that, well, first off, I appreciate you stating that, right? Like there is an art to it, but at the very basis of it in the core is a science, right? Like
yes,
there are really particular and clear things that can be done to help people's mental health, right?
Absolutely, absolutely.
And I know that you also do some training at times with your organization, right?
Yeah, we absolutely do. We do trainings in dialectical behavioral therapy. We do trainings around cognitive behavioral therapy. And I also wanted to mention to that point that it's a science that, there are people that have, really that have basically been spending their entire lifetime going from therapist to therapist to therapist and finding it completely ineffective, and not because it's therapy as a whole that fails, but because the clinician or whoever they're working with is not providing them the care that they need. It's kind of like equivalent to somebody with diabetes just going to a regular PCP and getting a checkup each time, right? I mean, there's more that has to happen in order for them to get better. So that's one of the things that I'm really passionate about getting that word out, and also in training other therapists and working with, those approaches if they're interested in specific populations that's actually going to help.
Yeah, that's terrific. Absolutely. And I really appreciate that analogy. So, and I feel like you've already started to talk about it, right? But like, how does your work help others?
Yeah, absolutely. So it's in definitely what I mentioned. And it's in also, just really just providing that care that we know is going to help. And for ourselves, even receiving that, whatever additional training, we're constantly also students in learning. But, really just looking at what the studies show and providing like the top quality care. So that's one way that we're hopefully helping.
Oh, wonderful. Yeah. Absolutely. And so, Liza, this is our last question.
Sure.
And of course, like with being mindful about confidentiality for individuals, but is there a story that you can tell us about how you've made a difference in terms of like helping a community, a family, a program, an individual, or an organization that you're comfortable sharing about how you've made a difference?
Yeah, absolutely. Would love to. One of the areas that my practice specializes in are anxiety disorders, and specifically OCD, obsessive compulsive disorders. And, I
Mhm.
have worked with individuals who've, again, gone through therapist to therapist, spent decades of their life really with very debilitating symptoms and not getting better until, they've worked with us. And it's not that we're like magicians over here, that we just provide something called
Mhm.
exposure and response prevention, and it works. Right. So that's
Wonderful.
definitely
Mhm.
one way that we've been able to support. And, I have countless examples of clients that have kind of gone through the practice and they get better relatively quickly. And then they can,
Mhm.
maintain a more positive quality of life. And that's what's important for us.
That's terrific, Lisa. Thank you so much for this
Sure.
overview today.
Of
And I'll
course.
put your contact information in the narrative. But if people want to reach you, what's the best way to reach you?
Yeah, I mean, they can go on our website and they can just fill out the contact form, or brooklynmindful@gmail.com is one way to reach us. And, if you have any
Terrific.
questions, feel free to reach out.
Okay. Thank you so much, Lisa. Have a great day.
Sure. Have a good night. Bye.
Okay. Bye-bye.